and patients. Mark?
Letitia, ER doctors say that more people are coming into local hospitals and emergency rooms thinking and complaining that they have H1N1. Docs say it's very likely that they don't, and actually coming to a busy, crowded emergency room could create more problems.
An empty hallway is usually hard to find in most emergency rooms across the Miami Valley. It's even more difficult over the last few days as the world's dealt with the H1N1 virus, or swine flu.
There is a little bit of a panic about swine flu.
Dr. Julie Knott says many extra patients have walked in or called her ER at Southview Medical Center. They're asking questions, looking for help, and requesting tests. But there's a problem with that last one.
We can't do a rapid swine flu test.
Knott says they can only take a sample and send it to the Department of Health for confirmation. But even then, docs don't expect tests to come back positive for H1N1.
In most cases, it's going to be your typical influenza virus that we deal with all the time.
Knott says patients who have traveled to Mexico are at the highest risk. If those people do come in, doctors send them home and ask them to stay away from others. Hand sanitizer is everywhere at Southview, as employees do their part to prevent the spread of any virus, including H1N1. They're ready to deal with any cases, even though they don't expect much of a fuss.
Most cases of swine flu, even in people that do truly have swine flu, resolve on its own just like any other flu virus, without any treatment at all. It's only these rare cases that we're seeing deaths.
Now, Dr. Knott says if you have flu symptoms, things, fevers, aches, vomiting, or diarrhea, call your doctor. If you have those symptoms and you've traveled to a place like Mexico, that's when it's time to take the extra precaution, go to a doctor, and get tested. Live in Dayton, I'm Mark Bruce.